All right, it's 9:47, and for those that have already joined us, we're just doing our first sound check. So we're going to ask that everyone please keep their mics muted. And again, it is our first sound check. It's 9:47, and we will start right at 10 o'clock. We look forward to you joining us.
Good morning to everyone. I'm just doing a quick sound check. Diane, can you hear me okay? This is Susan.
Yep, I can hear you loud and
Okay,
clear,
great,
Susan. Thank you.
great. And welcome to everybody. We'll be starting at 10 o'clock, so just in a few minutes. And good morning to everyone. If you're just joining us, you're in our Managing Diabetes in a Modern World webinar. Today is our Managing Your Risk, and it's our last presentation in our series. So I'm looking forward to hearing what Diane has to share with us, and we will be getting started at 10 o'clock. So welcome to everyone. Welcome to everyone. I'm glad that you're all here with us. We'll be getting started today at 10 o'clock, and I'm looking forward to hearing what Diane has to present and share with us. As you're waiting, excuse me, as you're waiting, if you want to check and make sure that your microphone is muted and you're not sharing your video, we will ask that you remain like that through our presentation. So we'll be starting in about 3 minutes. And again, welcome to everybody. So good morning. We're going to get started today with our presentation. We're happy you are here with us. It's November 11th. Happy Veterans Day to everyone, and welcome to Managing Your Risk. This is our webinar by University of Illinois Extension. It's part of our Managing Diabetes in a Modern World webinar series, and today is our last presentation in that series. Please remember that we ask that you make sure your microphones are muted. That helps to prevent any background noise during the presentation, and keep your cameras turned to off. This gives us a strong bandwidth throughout today, and we thank you so much for helping us out in this way. You can use the chat box today to ask questions. We'll be keeping track of those questions, and Diane will have time at the end to answer. And we do ask that you please refrain from answering questions in the chat box and leave it to Diane and myself to provide you with the most up-to-date research-based information. After today's webinar, you will receive an email with a survey link. Complete that survey within the next 24 to 48 hours. And after it's completed, we will send you the handouts from today's presentation, and look for those in about a week. Today's webinar is being recorded and can be found on the State Nutrition and Wellness website at go.illinois.edu, Nutrition and Wellness. For those that may not know, the University of Illinois Extension is the flagship outreach effort of the University of Illinois at Urbana-Champaign. We offer research-based educational programs to residents of Illinois in all 102 counties and far beyond. I am Susan Glassman, a University of Illinois Extension Nutrition and Wellness educator. I hold a master's degree in health education and administration and a bachelor's in food and nutrition. I've been with Extension for about 20 years, and I serve Bureau, LaSalle, Marshall, and Putnam counties. I will be your moderator today, and Diane Reinhold is our presenter. She also is a University of Illinois Extension nutrition and wellness educator. She received a Bachelor of Science degree in nutrition and dietetics from North Dakota State University and a Master of Science degree in nutrition and dietetics and a Master of Public Health degree from St. Louis University. Before joining Extension, Diane served as a clinical dietitian where she specialized in medical nutrition therapy for the geriatric and critical care populations, and diabetes education and supervised dietetic intern students. Diane's special areas of interest include obesity and chronic disease prevention and management, healthful lifestyles, food safety, and food preservation. Welcome to everyone once again, and I'm going to turn it over to Diane for her presentation.
Thank you, Susan, so much for that wonderful introduction. So as Susan mentioned, before coming to work for Extension, I worked for many years in the healthcare setting. Not all of those years as a clinical dietitian, but many of those years. And so diabetes is one of the chronic diseases that I'm very passionate about. And so I'm very excited you're able to join us today, and I hope that you're able to enjoy the presentation and maybe learn something new. So what is today's plan? What are we going to be talking about? Well, we're going to be talking about how important it is to know your healthcare team and to know that that's a larger than just your doctor or your nurse practitioner. We're going to talk about the importance of managing your blood glucose levels or your blood sugars. We're going to talk about the impact of high blood sugars or high glucose levels. And after we get through all of that, you might be feeling a little overwhelmed. So then we're going to share some good news. We're going to talk about the importance of diabetes self-care, of healthy eating, making sure you're getting adequate physical activity, managing your stress, and again, talking with your healthcare team. So it's important to choose a diabetes care team and the members of that team that can offer you support and that you feel comfortable talking with. You don't want to have a provider that you just walk in and they spend 5 minutes, maybe 10 minutes if you're lucky with you, and they're out the door. You want to make sure that you're able to communicate and that you feel comfortable with your healthcare, your primary care provider. Now, your primary care provider, it could be a physician, it could be a nurse practitioner, it could be a physician's assistant. Whoever you choose as your primary care, that typically is going to be one of the individuals that's going to lead the way in providing your care. And again, that's why they're called primary care provider. However, if you have diabetes, you may have other people on that healthcare team. You may have an endocrinologist. An endocrinologist is a physician that specializes in diabetes and other diseases of the endocrine system. And the nice thing is you may not need to see an endocrinologist if you have diabetes. However, if you are having a really difficult time controlling your diabetes, maybe you're a brittle diabetic, then you may end up having to see an endocrinologist. Typically though, in many situations, your primary care provider will be able to help manage your diabetes care. Another critical person that you're going to want on your healthcare team is a registered dietitian nutritionist. A registered dietitian is an expert in nutrition. And ideally, you're going to be seeing a clinical dietitian, someone that works in a healthcare setting. And with many professions, there are different types of dietitians. If you have a clinical dietitian, maybe your dietitian specializes in diabetes care. And as an individual that has diabetes or someone that is helping to care for an individual with diabetes, you're going to want to see a dietitian that really specializes in diabetes. But because this healthcare professional, they are very knowledgeable of nutrition, they may also cover different areas. Maybe it's a renal dietitian or a dietitian that helps individuals navigate the world of cancer. So they're working in the oncology department. The other important person that you are going to want in your healthcare team is a certified diabetes care and education specialist. This was previously known as a diabetes educator. And both your dietitian and your diabetes care specialist are individuals that are going to have lots of extensive training and experience working with individuals that have diabetes. Both of them need to pass certification board exams and maintain their continuing education, and they can help you manage and find out what you need to do to better manage your diabetes. Typically, it's going to revolve around adapting lifestyle behaviors and constructing an environment that is going to promote health and wellness. Now, I'm one of those people that, oops, bunny trail. When I said endocrine system and an endocrinologist. So that might, be pause for concern. And people say, well, I've never heard of that before. Well, let me just tell you a little bit about our endocrine system. The endocrine system is a series of glands that produce and secrete hormones that the body uses for a wide range of functions. The glands and organs make hormones, and they're released directly into the blood so that they can travel to the different tissues and organs all over the body. The hormones that are released by the endocrine system control many important body functions such as growth and metabolism and reproduction. But in the case of diabetes, it is going to be impacted by the pancreas. So the pancreas is part of the endocrine system, and the pancreas is a gland that produces insulin, and it helps us to control our blood sugar. So it helps with blood sugar regulation. All right, moving off that bunny trail, back to our all-star lineup of our healthcare team. Other individuals that you may want to really consider part of your team are or is your pharmacist. Pharmacists are really great educational resources that are often overlooked. Most people see their pharmacist more often than they do their healthcare provider, especially if you're picking up medications on a regular basis. So if you're having any difficulties with the management of your medications, perhaps you're forgetting to take them, having a difficult time swallowing them, you're having difficulty reading the labels, speak with your pharmacist. They're a wealth of information and they're there to help you. Another team member that you're going to want to be tapping into is your ophthalmologist or your optometrist. Now, an ophthalmologist is a medical doctor. It's your eye doctor. The only difference is that with your ophthalmologist, that is going to actually be a medical doctor. An optometrist is not a medical doctor. However, they have extensive education and they specialize in eye health, and they can help treat certain eye conditions and diseases. And my sister is actually an optometrist, and she has actually told individuals you need to go to the emergency room right away. She's helped diagnose individuals with really high blood sugars. They were didn't realize that they were diabetic, but by looking in the eye, she was able to say, okay, we have some major issues going on. And so she sent them off to the emergency room, and they were able to be treated. She's also diagnosed individuals with really high blood pressure. And so, believe it or not, simply being able to look into your eye health is going to tell you a lot about your overall health condition. Now, you may also want to have a podiatrist. A podiatrist, sometimes called the foot doctor, is someone who is trained in not only dealing with your feet, but also dealing with lower leg problems. People with diabetes should really have their feet checked and inspected at least once a year by their healthcare provider or podiatrist. Now, you don't necessarily need to have a podiatrist. Often your healthcare provider can do those inspections. However, if you end up with problems, you may end up being referred on to a podiatrist. Another team member, which people may not necessarily realize that you need to have on board when you're dealing with diabetes, is your dentist. Now, your dentist knows all about, taking care of your oral health. But it's very important to let your dentist know if you have been diagnosed with diabetes or if you have diabetes, because diabetes increases your risk of developing gingivitis or periodontal disease, and you're 3 to 4 times more likely to have dental issues compared to those without diabetes. And you should be seeing your dentist if you have diabetes at least twice a year. All right. So also, when you're talking about your team, individuals you may not necessarily think, oh yeah, I should have them on my team, is an audiologist. And so hearing loss and diabetes can occur. If you notice changes in your hearing, you want to seek out the help from a specialist, such as an audiologist, and that is a healthcare provider, a physician that is able to examine your hearing. And typically, if you have diabetes, you should consider, and if you're experiencing hearing problems, you should consider having your hearing tested yearly. Other individuals, you might want to seek out the help of a mental health professional. So finding a counselor. There's a lot to deal with when you're managing diabetes, and it can seem overwhelming. So sometimes you may want to reach out and seek the assistance of a professional to help you navigate those daily challenges and stresses that you may face when dealing with diabetes. Another healthcare professional you might want to look into is finding a fitness professional, someone who is trained specifically in dealing with physical activity for individuals that have diabetes. If you are taking insulin or medications, that may cause you to have highs and lows of your blood sugar at different times. And so you need to be aware of, when is a good time to engage in those physical activities. And these professionals can help you find exercises and activities that are going to keep you safe and ensure that you get the most out of your physical activity regimen. And they're going to also understand how diabetes and physical activity work together. All right, so that's our team. Um, Now we're going to switch gears and we're going to talk about kind of some of the complications or some of the issues that can arise if we have poorly controlled diabetes. So uncontrolled diabetes simply means that your blood sugar levels are too high. Even if you are taking medication to treat it, some individuals, well, I can share, I had an individual in a class, and she said when she was first diagnosed with diabetes, she was mad. And she said, I don't have diabetes. I don't want to take this medication. And so she didn't. And then she ended up in the hospital after a short time span. And she was like, okay, well, um, by being upset and angry at the fact that I have diabetes and not taking my medication, that is not going to help me out. And so she decided that she needed to take control of her health and she needed to learn how to manage her blood sugar so that she didn't have complications. And when you have high blood sugars, that can often lead to a cascade of symptoms. And in the long term, it takes a significant toll on your organs because damage is going to occur to the blood vessels and the nerves that are supplying the nutrients that those organs need and ensuring that they're getting the nutrients that they need. So we're going to take a little deeper dive and we're going to first look at cardiovascular disease. Cardiovascular disease, that's just a big long word for heart disease. And heart disease is, think of it as an umbrella. And underneath the umbrella, you can have many different aspects. Diabetes is going to dramatically increase the risk for various types of cardiovascular problems. And those problems could be coronary artery disease. You could be, or you are at increased risk for heart attack and stroke, as well as arteriosclerosis, which is the narrowing of the arteries. And high blood sugars actually cause damage to your blood vessels and nerves. And if you have diabetes, you're twice as likely to be diagnosed with heart disease. And the younger you're diagnosed with diabetes, the greater chance you're going to have of being diagnosed with heart disease. And unfortunately, 2 out of every 3 people with diabetes are going to actually die from either a heart attack or stroke. And so unfortunately, the simple fact of having that high, having diabetes is going to put you at increased risk. And part of the reason is it's multifactorial. When you look at your health, you have to consider the fact that it's not just diabetes, it's not just heart disease, it's not just because I'm not getting enough physical activity, it's not just because I'm not eating the appropriate size portions or more complex carbohydrates or more sugar. So it's really a combination of multiple factors. And so when you think about your health, think about it in the sense of your health is like a giant puzzle. And when we talk about heart health, that is one section of the puzzle. But at the end of the day, that section of the puzzle is going to go into the puzzle to be able to show you the large picture of your total health outcome. If you have diabetes, often you have other health issues going on. People with diabetes tend to develop heart disease at a younger age, and they also tend to deal with other health heart issues, such as having high blood pressure, having high LDL cholesterol, and that's our unhealthy cholesterol, also having high triglyceride levels, and low HDL. There's good news at that. when we get closer to the end of the presentation, I'll tell you all the wonderful good news, because these complications don't have to occur. So peripheral artery disease, sometimes it's just called PAD. It's the process in which plaque builds up in your blood vessels and walls, and it can restrict the flow of blood and oxygen to your legs and your feet. So depending upon the severity, it can cause a lot of pain in your lower extremities, especially when walking, as well as causing numbness, tingling, and it may cause your feet to be cold. Unfortunately, it's a very common issue that individuals that have diabetes have to deal with. It's estimated that 1 out of every 3 people with diabetes over the age of 50 have peripheral artery disease. So that's something that you need to be aware of, and you need to take strategies in order to address it. The next topic we're going to talk about is nerve damage. So I really liked this image, and that's why I included it. If you look here, we have, glucose in the blood. So we need glucose in the blood. Our insulin works, and then it sends the nutrients, then the glucose is the nutrients, to our cells and our tissues. However, when we have that uncontrolled blood sugars, uncontrolled high blood glucose levels, and you can see all these little extra white ones in there, what ends up happening, that is going to contribute to the buildup of this plaque and the fat and the other type of substances that end up building up in our arteries and causes that narrowing. When it comes to our nerves, our nerve health, neuropathy is simply a term for nerve damage. And you can imagine, with all of this extra sugar in our blood system that isn't supposed to be there, it ends up causing injury to our cell walls and the walls of our vessels. And that's really important, because if those walls and vessels are being injured, we're not going to be able to nourish our vessels, we're not going to be able to nourish our nerves as well. And that can lead to damage to our nerves. Symptoms of nerve damage, that tingling and numbness. You can also have a burning pain or sensation, or you may simply have a lack of sensation to pain and temperature. And I use this example. My grandma, who had diabetes, loved to do crafty projects and sew and do things like that. And one day she dropped her sewing needle, and the next day my brother came over and she said, "Hey, I dropped a sewing needle. Can you look down on the carpet and see where it is?" And my brother got down on the floor and he's looking and he's like, "Grandma, the needle's in your toe." And so we don't know how long she had walked around with that needle in her toe, but she wasn't able to feel that sensation. She wasn't able to feel that pain because of the nerve damage that had occurred. And so when we're talking about nerve damage, you have to really be mindful. So over here we have a healthy nerve, and you can see that the axon, all of these little the axon is intact, and you're able to get the message from the nerve to the synapse, and then that message can go back and forth throughout our neurological system. However, here we have an unhealthy nerve, so the myelin sheath has been damaged, and so it's not getting that message. And that, again, that damage can occur when we have high blood pressure or high blood sugars, and the nerve isn't able to be nourished in the way that it should. So nerve damage can lead to a whole host of problems besides not having feeling in your extremities as well as you should, but it can lead to digestive problems. You can end up with something called diabetic gastroparesis, and so that affects your your GI tract. And it can cause nausea and vomiting. It can also lead to problems of diarrhea and constipation. But typically with diabetes or diabetic gastroparesis, you have an issue with delayed emptying of your stomach. So maybe you eat a little bit and then you feel full, but you really haven't eaten very much to nourish your body. Or you may just feel that nauseated feeling, or it may even lead to vomiting. For men, it can lead to erectile dysfunction. And so that can be a huge issue. Again, think about how everything in our body is impacted by the nerves across our neurological system. It can also contribute to hearing impairment. Hearing impairment is much more common in individuals that have diabetes, and it can also lead to muscle atrophy. And that simply means that our muscles are not able to work and function as well because it's not getting the message for those muscles to move as well. The next condition we're going to talk about is nephropathy. And diabetes can cause damage to your kidneys. In fact, about 1 out of 4 adults with diabetes are going to end up having kidney damage. And so nephropathy, nephro is kidney, and then apathy is then the damage that can occur. And so diabetes is the leading cause of kidney damage. As I said, 1 in 4 individuals with diabetes will develop kidney disease. And what ends up happening, you have damage to these tiny little vessels in here. And so I tried to blow this picture up really big, but there's tiny vessels that filter out the waste from our blood. When we do that conversion of like, hey, it's in the blood and we're going to create urine, that is what happens. And if you haven't noticed, I know one thing I've noticed is that over the past 10 to 15 years, it seems like there's so many more dialysis centers. And that is in part because so many more individuals have diabetes. And unfortunately, many people are not properly managing and controlling their blood sugars. Unfortunately, with nephropathy, that is something that occurs slowly. It occurs over time. And so here you can see a normal kidney. And then as the damage occurs, it becomes enlarged. And so just because it's enlarged, you don't necessarily, doesn't mean that it's working better because there's more of it to work. It simply gets bigger because it's not working. And so it's trying to, make itself work better. So factors that can influence kidney disease, it's not just diabetes, but there can also be a genetic predisposition. If you have some different types of genetic disorders, of course, poorly controlled blood sugar and having high blood pressure. And it's important to understand that, like, when our bodies are digesting the protein that we eat, it's going to create waste. And the kidneys have millions of teeny tiny little blood vessels, and they are going to help filter, that protein or any type of medication or any other type of molecules through our body, and then we're able to excrete the waste and then keep the good stuff. Other names for kidney damage or kidney damage, I should say, are diabetic kidney disease or chronic kidney disease. You could say you have kidney disease of diabetes or diabetic neuropathy. Or nephropathy, I should say, nephropathy. So a lot of times, the longer you have diabetes, the more likely that kidney damage is likely to occur, and it can eventually contribute to irreversible end-stage renal disease, and then you may end up on dialysis. Moving right along, I've already mentioned that hearing loss can occur. Studies show that hearing loss is twice as common in people who have diabetes compared to those that do not. In fact, a 2008 study, researchers analyzed the data from individuals between the ages of 20 and 69, and they concluded that diabetes may contribute to hearing loss by damaging the blood vessels and nerves. However, more research is needed because they don't know the exact reason for the hearing loss. So this is what what their study concluded. However, much more research is needed. One thing that I thought was really interesting when I was reading through research information was that women who have diabetes may experience greater hearing loss compared to those without diabetes. And that's even if you have well-controlled diabetes. So simply having diabetes then puts you at increased risk for hearing loss. But it's very important that it is well controlled, so you decrease the overall risk. Now we're going to move on to diabetic retinopathy. So diabetic retinopathy involves changes to the retinal blood vessels that can cause them to bleed and leak fluid into your vision. So again, our eyes, like our ears, are very vascular. And so when I say very vascular, you should be thinking about, okay, well, if I have extra sugar in my blood that, because I have poorly controlled blood sugars, that can cause damage then. And so, as I said, it can cause damage to the retinal blood vessels, and that can cause them to bleed and leak fluid, and that's going to distort our vision. And diabetic retinopathy is the most common cause of vision loss among individuals with diabetes, and unfortunately, it's the leading cause of blindness. It damages the blood vessels in your retina by changing the blood supply, and it can distort our vision. So here are some other images of eye damage that can occur. So here's a healthy eyeball. So going back here, you can see this one has some problems where you have some leakage going on. But here's our little healthy eye. And okay, here's our healthy eye. If you have diabetic retinopathy or eye damage, you can have a group of eye conditions that are going to specifically affect individuals with diabetes more so than those without. So you could have diabetic macular edema, you could have cataracts, or you could have glaucoma. Diabetes increases the risk of these other serious vision conditions. And here I just thought, again, these were some really helpful images. I'm a visual person, so being able to see something kind of brings everything together. So of course, anyone can get cataracts, anyone can get glaucoma. However, if you have diabetes, the probability of being affected by cataracts increases by 60% if you have diabetes compared to someone that doesn't have it. So it's very important that you take your eye health serious. And this is why you are encouraged to see your optometrist or ophthalmologist at least once a year to have a full workup. They're going to dilate your eye. When they dilate your eye, they're going to be looking inside. They're going to be able to see all these vessels that are deep within our eyes, and they're going to be able to monitor for changes. Our eye health is very important. The good news is we can prevent it by managing our blood sugars, making sure we're eating a healthy, balanced diet, that we're engaging in physical activity, and that we're taking our medications appropriately. But it's really critical that we're receiving that comprehensive dilated eye exam at least once a year. And if you're starting to lose your vision, or if you have some type of other eye damage occurring, you may need to see your provider twice a year, depending upon the situation. So diabetic macular edema, it's a consequence of having diabetic retinopathy, and it causes that swelling in the area of the retina called the macula. And what ends up happening, you have edema or swelling in the region of that macula. And it's important, the macula is important for having sharp, straight edges. And so, having that more crisp vision. And when you have diabetic edema, macular edema, you can then compress different nerves, and that can lead to significant issues. And about 50% of individuals that have diabetic retinopathy will go on to develop diabetic macular edema. So again, this is why it's incredibly important that you're including the optometrist as part of your healthcare team when you're looking at effectively managing your diabetes. All right, skin health. Skin health is incredibly important, and many people with diabetes will go on to develop some type of skin disorder, and that's because if you have high blood sugars, again, it's reducing the blood flow to those nerves and vessels, and it reduces the skin flow or the blood flow to our skin. And when you have that decreased blood flow, then you are increasing the risk of other complications, such as decreased blood flow causes changes in our skin's collagen. That means then that our skin, the texture can change, the ability for it to heal, and even the appearance can change. So if you factor in, again, thinking back to this big puzzle piece or puzzle that I always refer back to, and how, our health, each section of our health is one piece of the puzzle. And so, first off, we're aging. Every single day we live, we get a day older, and aging's occurring. And so we have natural aging processes that go on that are going to impact our health. So automatically, the fact that we're aging, it's impacting our collagen. But then if we have diabetes and we're not controlling those blood sugars, then that can cause additional changes to our collagen. And it can, again, it causes decreased blood flow. It impacts our texture of our skin, the ability to heal, and we're more susceptible to damage, because if our skin isn't working properly, it's not just our skin, what's inside our skin, sweat glands. And so if the sweat glands aren't working properly, we're not going to produce that sweat. And that sweat is important because it helps to some degree with friction that occurs when we're engaging in activities that cause us to perspire. And so the other tidbit to be aware of is that some medications can also increase your risk of skin-related problems. And having high blood sugars can also put you at increased risk for yeast infections, such as thrust. It can also cause skin infections like cellulitis. So if you've ever known anyone who gets swelling in a lot of times it's your lower extremities, and maybe their skin is weeping. It looks like it's like sweating, but really it's just so swollen that you have it's called lymphedema, and you have your skin is weeping, and so then that further breaks down your skin. Plus, you can have issues with increased sensitivity to temperature or pressure, or you could have the reverse happen where you are not able to detect if something's cold or hot, or if you get a new pair of shoes and it's rubbing, especially on the tops of your toes or the bottoms of your toes or on your heel. Um, and then that can lead to maybe a blister. And before you had diabetes, having a blister wasn't that big of a deal, but factor in the fact that now you have diabetes, now you're a day older, and if you have any other health issues going on, that can contribute to problems. But I don't want you to be thinking, oh my gosh, if she says one more bad thing, because I'm not here to, scare you. I'm just here to help you increase your awareness so that you know, like, hey, these are things that can happen. And this is why it's really important that I manage my diabetes, and those that I love, that they're managing their diabetes. And so again, I'm not here to like implement scare tactics. I just want you to have a greater understanding of how it all works together, how it really is one giant puzzle. Now, with that said, I'm just going to keep moving along because I have lots to go over. Um, Diabetes actually can impact our cognitive function, especially if we are diagnosed with diabetes early on. Remember, the earlier you're diagnosed with any chronic health condition, the longer it has to wreak havoc in your body, and therefore it's important then that you are managing it appropriately. Long-term diabetes, or those who develop diabetes before the age of 65 have increased risk of mild or noticeable memory problems. And therefore, again, it's very important that we are managing our blood sugars. Thinking back to the damage that can occur to our blood vessels and nerves, think about our brain. Our brain, very vascular. And so if we have high blood sugars, that can further exacerbate the inflammation process that goes on. It can impede our blood flow. It can cause our brains to not be getting the oxygen that it needs. And with all of this, in addition to the cognitive changes, we can end up having diabetes distress. And diabetes distress is a rational emotional response to having to treat a life-changing illness. Now, I say life-changing because it's not necessarily life-threatening. It can be if it's poorly controlled, but it's life-changing because if you have diabetes, you have to implement significant lifestyle behaviors to ensure that you can have the best quality life possible. Diabetes and mental health, the lifetime prevalence of generalized anxiety disorders is estimated to be almost 20% in individuals that have type 1 or type 2 diabetes. And that's because a lot of times individuals become very overwhelmed with all of the specific concerns. They have to learn to address the fears. And I think that just by being here today, you're addressing a fear because you are becoming aware of, okay, what do I need to do? What do I need to be aware of? What questions do I need to ask my healthcare provider? And so being aware of all of these different things, knowing who to have on your healthcare team is going to help alleviate some of those fears, so that you can have good control of your blood sugar. And if you are taking insulin, if you're doing injections or infusions, that you know who you can go to and who you can ask. If you're fortunate that you're not on insulin at this point, then you can just be encouraged to know that you can make changes in your lifestyle, because there is good news. Complications don't have to happen. And it's simply by properly managing your diabetes that can reduce the risk of your complications. It can reduce the risk and anxiety that you're feeling. And you're going to manage that through if you've been attending all of these different sessions, you're going to manage that through eating a proper diet, monitoring your health numbers. And that's why we say know your health numbers, and being physically active. So diabetes self-management is an ongoing process of facilitating your knowledge, your skill, and your ability to manage your diabetes or the diabetes of a loved one. And this process is going to incorporate goals and your life experiences. And you know what? It's going to be trial and error. You're going to have to do problem solving. Maybe this worked when you were, 48 and diagnosed with diabetes, but now that you're 58, that's not working so good anymore. Kind of have to go back to the drawing board and figure out what's going to work now that you're 10 years older or 20 years older, and reaching out to your diabetes care team. And diabetes self-management is so important because it's going to help you have improved health outcomes. It's going to give you a better quality of life. And that's really what we all want. We want to be able to go through life and have a good quality life. But at the end of the day, that comes down to your lifestyle. But the good thing is you are all attending this session. You hopefully attended the lesson where Susan talked about finding balance in your diet. And she talked about using the plate method. So making half of your plate be non-starchy vegetables, and then incorporating a lean protein, meaning one that is low in saturated fat, low in cholesterol, and incorporating a quarter of your plate so that it's either going to be whole grains or starches. Because remember, some vegetables are starchy vegetables, other vegetables are going to be non-starchy vegetables. And of course, getting lots of water in. Water is incredibly important no matter what type of chronic disease you're dealing with and managing. So being physically active is super important. If physical activity could be bottled, that would be our magic pill for any of the chronic illnesses, whether you have diabetes, heart health, COPD, anything. Physical activity has so many wonderful benefits. I can't even There's not even enough time for me to tell you all the wonderful benefits, but I'm just going to tell you kind of a few of them. Being physically active is going to help strengthen your bones and your muscles, and that's incredibly important as we're aging. It can help manage your weight. Now, does that mean that, oh, if I get physically active, I'm all of a sudden gonna, drop 20 pounds and life's gonna be wonderful? Nope. But you know what? It's gonna make the insides of your body, the things that you can't see, it's gonna help with your vascular health. It's gonna help with the management of your blood sugars. It's going to decrease the risk of some types of cancers. It's going to improve your mood. It's going to be able to help you think more clearly. It's going to improve the quality of sleep, as well as, and this is really important, it's going to decrease your risk of falls. And this is especially important as we're aging. So being very intentional. That way we can, again, have that good quality of life and increase our chance of not only living longer, but living an enjoyable life longer. Now, when I say physical activity is super important, this is something I get really excited about. Most people roll their eyes when I tell them this, but it's important. Physical activity, the recommendations that came out in 2008, they've been updated, the 2017 recommendations. Earlier, they said we needed at least 150 minutes of moderate intensity physical activity. But the new recommendations that came out in November of 2017, they said, you know what? Physical activity is so important. We're now going to recommend 300 minutes a week of moderate intensity physical activity. Now, 300 minutes might seem really overwhelming to a lot of people. So I always say start with the goal of getting 150 minutes. And if you break that down, that's less than 30 minutes a day. day. 30 minutes a day, 6 days a week, that's 180. And the reason I say 6 days a week is because no one's perfect. Not everyone's going to be able to, get 7 days in. But it is a goal to have and to aim for. And of course, always incorporating that muscle strengthening activity on at least 2 or more days a week and working all of those major muscle groups. Now, if you don't necessarily have 300 minutes and you're like, I'm super busy, I don't have time for this, then you know what? You need to up the ante, increase the intensity, go from a moderate intensity to a vigorous intensity. And then you only have to work out for 75 to 150 minutes, which is very doable. And again, this all might seem really overwhelming, but here's the thing, break it down into 10-minute increments. And you can mix moderate intensity with vigorous intensity. So those are all some helpful tips. And I can't remember who in our presentation talked about setting goals. I don't recall if it was Susan or if it was Mary Liz, but really having a goal. Setting goals is incredibly important no matter what you're trying to achieve. But you need to be able to set that goal, track that goal, and it's important that you are incorporating all different components within your goal setting, that healthy eating. So Kristen talked last week about making sure that you are limiting the salt and the fat in your diet, as well as the added sugar. And understand that there is no one single diabetes eating plan. The plate method is probably the most common, carb counting if you're taking insulin, but there is no one specific diabetes eating plan because what works for you might not work for your neighbor. One of the key factors with managing and eating healthy is always looking at that nutrition facts label. That's going to tell you critical information. How many grams of fiber, how many grams of protein, how many grams of sodium or milligrams of sodium. These are all really important things. And of course, what I'm talking about today, and I believe Caitlin talked about it a couple weeks ago, about talking to your healthcare provider. Tapping into those resources, understanding you are not alone. There is support out there, and you can find it. And again, I mentioned briefly about diabetes distress. When you are diagnosed with any type of chronic illness, whether again diabetes or heart disease, you can have a range of emotions, and that's okay. You can be in denial, like the lady I told you about. You can be angry. You can try and do some bargaining, and you can even have some depression. Like, this isn't fair. I'm going to go eat worms, and you can feel overwhelmed and angry. But at some point, you have to come to acceptance. And it isn't until you come to that acceptance that you're able then to move forward and work through, all of the obstacles and challenges that you feel you may be facing with the diagnosis of diabetes. And, it's really important that you manage your stress. Stress is incredibly, we have good stress, we have bad stress, but you need to be able to identify your stress source, and then develop a healthy coping strategy. And all of us, if we're living life, have some form of stress, but it's up to us how we're going to deal with it. And so one of the things that I like to challenge individuals that attend my classes is to change the way you think. When you change the way you think, you change your experience. And then you can better find a way that is going to allow you to address that stress, and it's going to impact your long-term health outcomes. Actions to maintain and attain or regain good health are going to be both short-term and long-term, but at the end of the day, it's going to be a lifestyle that you are going to adapt. And so when you're managing your risk for diabetes, it comes down to prevention, intentionality. You need to manage your blood sugar. You need to truly eat a healthy diet, meaning one that is low in added sugars, low in processed foods. You need to get that physical activity in. And yes, it's going to be difficult, but you know what? so is life. And to be successful, you just have to have that positive attitude and move forward. And then of course, take your medications as directed. Never skip your medications. If you're feeling sick and you don't know if you should take your medication, call your healthcare provider, whether it be your pharmacist or your primary care provider, to find out what you should do. Make sure that you're attending all regularly scheduled visits, whether it's your annual visit with your eye doctor, your audiologist, your dentist, and then of course know your numbers. And it's up to you to be empowered. And that's why I'm thinking, have continued your journey along with us here at the University of Illinois Extension, and you've attended all of the different trainings that we've provided. The nice thing is these trainings are going to be available online, so you can just check out our website. I know Susan mentioned it earlier, but check out our website. You can go back and listen again. Maybe someone was talking too fast like me, and you're like, I want to listen again because she went way too fast. But I wanted to cover all of the information and get this out to you and still have a few minutes for questions. So Susan, with that, do we have any questions?
Yeah, thank you, Diane, for sharing all of this information and giving us so many great things to think about today. We have one question, and someone was asking if you would need a referral from your primary care physician to go see a specialist, such as like going to see a podiatrist.
So it's going to ultimately depend on the type of insurance that you have. So I would check with your insurance provider, and that would be the first place I would start. And then after you found that information out, then you would be able to move on and talk with your healthcare provider to find out what that process would be.
Yeah, and make sure, follow up. If you feel like you need to see a specialist, continue to work with them and get that referral with your insurance so that you're getting the care that you need. Wouldn't you say so, Diane?
Absolutely,
Yeah,
yes,
so
definitely. And you know what? It may take calling 2 or 3 times.
it may, yeah.
Yeah, my mom was frustrated. She wanted to go see her healthcare provider, and they said that they were only seeing healthy people. No, I can't remember. I think they were only seeing healthy people, and she was sick, so it was taking her longer to get in, or maybe it was vice versa with COVID. So things might be a little bit more jumbled up depending upon where you're living.
Yeah, so make sure to keep following up because it's important to get that guidance from our specialists and our experts to help us maintain as great of health as we can. So would anyone else have any more questions? You're welcome to add them into the chat box. We're nearing 11 o'clock. And so once again, Diane, thank you for sharing all of this information. It gives us so many things to think about and so many great ways to prevent those risks. So we really appreciate that. And I also wanted to share that we are going to continue on in our webinar series. We will be offering a Health at Home Holiday Edition, and there'll be more information coming out, but we want to promote a season of health and peace and balance. And so if you want to write this down in your calendar, we'll be offering those webinars on Tuesdays from 6:30 to 7 p.m. They're 30-minute webinars, December 1st, 8th, and 15th. So look for more information from that. And then also make sure you check your email for the survey that will be coming out. And we both want to thank you. Again, thank you so much, Diane, for sharing this.
You
And
are very welcome. And
everybody, again, happy Veterans Day, and
yes,
thank you for being with us. Take care. Bye-bye, everybody.
thank you. Bye.